Good morning. My name is Dr. Sunny Anand, and I'm a professor at Stanford University. And it is my great pleasure to welcome all of you to the 6th annual Ideal Village Conference. This has been a tremendous journey, and I would like to share my slides to show you where we've been and where we will be headed. So the theme of this conference today is post-pandemic normal, the path forward.
So the key elements of the Ideal Village are really three important pieces. One is collaboration, second one is holistic solutions, and the third is sustainability.
The global death toll from the disease stood at well over 5.5 million. On a more positive note, around 5.7 billion vaccine doses have been administered.
One thing that brought me in this fold of technology was recently my association with Wills Global Foundation, which is IIT Indian Institute of Technology alumni who have started this charity organization.
We are talking about Ideal Village Center. We are talking about rural empowerment. What does the word rural conjure up in my mind? As a person who's worked in international diplomacy for many decades, when I mapped the rural community in India, with which a lot of the speakers have been passionately and actively engaged, what do I see is a population of between 800 million to 900 million people. A population which is more than the entire populations of two big continents like North America and South America put together. A population more than the African population, more than the entire European population, more than any other continent in the world. I'm going to request my colleague and my co-author, whom I value and respect very much, Dr. Joseph Chalel, who's a physician.
So I think the biggest problem we have, whether it's in India or in the US, is that we treat it, even though we call it healthcare, I'm not sure we truly care about everyone's health. This is more of a disease care system we were working on, or we were happy with for the past decades, whether it's in India or other places in the world, is that, we didn't care whether the patient was working out or eating right or exercising every day or not drinking and smoking or anything else. It's just that when we get sick, we'll fix you up. And that's the whole thing was all about. So we need to change that. We also need to maybe combine and collaborate between our public health and the patient care. It all acted as two different systems worldwide. Again, things you could do, as Ambassador mentioned, from developing human resources in healthcare to simple things like supply chain, which is very critical in here, that we relied on one country for everything from our masks to cotton balls to injection syringes to needles. And now, whether it is the defense or it's in medicine, it's not acceptable that you have to have just one country providing everything. And then in the case of a war, a bioterrorism, or a pandemic, that we suddenly don't have enough supplies. And we had all this perfected just-in-time inventory and Six Sigma into management of hospital inventories, and everybody ran out. So this is not unacceptable. This is unacceptable. So we need to change that.
When you walk around and when you see a drooping face, do not just pass by them. Just take the few seconds or just a moment to stand with them and ask them, hey, how are you doing? How can I help you? What is that you want? These few gestures can uplift the human spirit. To some extent, it can help people to open up.
I appreciate the chance to talk to you about a new partnership model that we are going to try here in Arkansas between government and our hospitals. And this is actually in the rural areas of Arkansas, in our very, very small towns.
I think when we start looking at the potential that the rural parts of the world, in India, there are 700 plus million people, which is more than the population of Europe and USA combined. Thank you all the participants. Thanks. Thank you on behalf of you.
Stay safe, everyone. Bye-bye.
Big round of applause for you.
Thank you,
Anand and
Sundar.
Dr. Thomas.
Sunny, thank you, everybody.
Thank you all for your attention and for your participation.